support healthcare services in schools. My name is Shamika Davis, and I'm a program manager at the School-Based Health Alliance. The School-Based Health Alliance is a DC-based nonprofit founded in 1995 and serves as the national voice of school-based healthcare. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is one solution, bringing healthcare to where students typically spend the majority of their time, in school. When schools, families, students, and the community work together, students win. I would like to share a few reminders for today's webinar. All attendees are in listen-only mode. To ask a question during the webinar, please use the Q&A function. Closed captioning is enabled for this webinar. To turn it on, please click the CC button on your Zoom control panel. At the end of the webinar, we invite you to complete an evaluation. Your responses are important for helping us to understand how to improve our work. And also, a copy of the slides and recording from today's webinar will be available on the School-Based Health Alliance website in the upcoming days. I would like to share the learning objectives for today's webinar. Our learning objectives are that attendees will be able to learn how to obtain buy-in and support from the school system, to learn how partnering with the school, improving parent engagement, and improving outreach can help move towards sustainability for a school-based health center, to learn transportation strategies that will allow other students within the school system to access the schools with the school-based health center, and to learn how telehealth services can be used to help with outreach and parent engagement within the school-based health center. I am happy to introduce our presenter for today, Clifton Bush. Clifton Bush was born and raised in Albany, Georgia. Clifton earned a Bachelor of Science in Healthcare Administration and a Bachelor of Science in Business Management from Albany State University in December 2004. In May 2006, Clifton attended Troy University and earned a Master of Science in Healthcare Management. Clifton is the Chief Operating Officer for Albany Area Primary Healthcare Incorporated, where he oversees the day-to-day operations of the organization in Southwest Georgia with 33 locations, which include a number of school-based health centers. Clifton also developed and started the first school-based health center in the Dougherty County School System, which is currently at Turner Elementary School. Clifton is a member of several organizations such as the Kiwanis Club of Albany, Georgia, United Way of Southwest Georgia Board, and the National Network of Oral Health Access Board, to name a few. Clifton is also an adjunct professor at Albany Technical College. I now welcome Clifton Bush. Clifton.
All right, good afternoon, everyone. I'm going to quickly share my screen here. All right, again, good afternoon. As Shamika said, I'm Clifton Bush, Chief Operating Officer for Albany Area Primary Healthcare, and I'm glad to be here on this afternoon to talk with you about partnerships and pathways to support healthcare services in schools. So as we get started, I want to give you a little information about my organization that I work for, because I'll talk about a lot of the programs and partnerships and things that we have done. So again, Albany Area Primary Healthcare is a federally qualified health center that was established in 1979. How the organization was developed, there was a grant to develop a clinic in Lee County, which is Leesburg, Georgia. And it was based on a thesis project regarding the lack of care for women and babies in the community. And it was particularly around prenatal care. We do have OBGYN services, which we did not implement until 2009. In 1982, we had 3 locations within our organization, and today we have 33 locations, which includes 10 school-based health centers. Our first school-based health center opened in March of 2013. And this just shows you some of our school-based health center sites. Some are in elementary schools. We have, middle schools, and then there's one in a high school. And then we have some, which I'll talk about with like the transportation partnerships that we have with the school systems, is that the school-based health center may be in the elementary school, but the middle and high school students have access where they're transported over, working with partnership with the school systems. So services that we provide in our school-based health center are primary care services, adults and pediatrics. We have dental services in some of the schools, optometry and vision services in 2 school systems, behavioral health services, and then transportation services, which is, again, I'll talk about a little later. And then we also provide mobile health services. So we have 2 mobile units, which we utilize them for primary care services and also for vision services. And I'll talk a little bit about those in a few as well. So our first school-based health center that we started out was Turner Elementary School-based Health Center at Turner Elementary School. And at the time, there was approximately 500 students in the school, with about 50 faculty and staff, and the school is grades K through 5. And majority of the kids were on free or reduced lunch. Now all kids are 100% free or reduced lunch. And then 90% were African American. And then less than 5% utilize English as a second language. So school system buy-in and support. How do we make this happen? How do we, get buy-in? So a couple of things that we do within our school-based health centers that I think is highly important is meeting with the superintendent on a quarterly basis. I have access to all the superintendents. I have probably all the school systems I have all their phone numbers in my cell phone and can reach out to them any time. But the other important thing is meeting with them on a quarterly basis to give them updates on how the school-based health centers are working in partnership with the school system, and also sharing data with them. The data of how many kids are being seen at the school-based health center, what programs, what type of other partnerships, things that we're doing within the school system, how can we help them, and then get feedback from the superintendent on different things that they may be doing within the school system that we may not be aware of, or in different grants that we can help support them. And that has helped with a lot of conversation with behavioral health, mental health services, where the school systems have gotten, certain grants, and then, by them not knowing certain things that we're doing, then, they utilize us for those services. Also utilizing the data helps the superintendents to know kind of how the school-based health centers are doing, kind of how attendance is looking, et cetera. And so it's, highly important to, meet with the superintendent on a quarterly basis. Also meeting with the principal and assistant principals at the schools that you have a school-based health center is highly important as well. Again, sharing that data, any data that you have, any type of programs, anything that you feel you could bring to the, to the school in partnership with the school-based health center. Also, any type of grants. So there are grants that we have applied for that, the school system, it has to go through the school system, but we have talked to the principals and assistant principals and say, we think this will be a great thing for your school, but it has to be applied on behalf of the school. And so we would, being that our organization has expertise in grants and et cetera, we would write the grant, and then the school system would look over it and sign off on it. And we have gotten some grants to help certain schools, which I'll talk about in a few. And the other thing is meeting with the district wellness committee director. One of the things in one of the school systems is we found out the district wellness committee was not highly functional. And so we actually, our clinic director for the school-based health centers actually worked with the nutrition director and chaired the district wellness committee along with that, the nutrition director, and actually got it back, full force to where it need to be, and got a lot of partners, et cetera, to come to the table within the community to serve on this committee. And there was some great things that I'll talk about in a little while that actually came out of revamping and reorganizing the district wellness committee within this particular and within Dougherty County. And so again, I'll talk about those things in just a few. Attending some of the faculty and staff meetings at the school where the school-based health center is located. Doing that on a regular basis. Again, just talking to the faculty and staff about the school-based health center, giving them data, stories. Stories are very important. People remember stories probably before they remember a whole bunch of data. And so by them hearing those stories, they are going to continue to spread the good of the school-based health center and how it's partnering with the school to make, attendance, academics, and wellness for the students, et cetera, better. Also updating the school board on a quarterly basis. So if you're allowed to, try to get on the school board agenda to update them on the status of the school-based health centers within the school system. Sometimes the superintendents in our counties do that, and sometimes we have went to the school board to give them an update of how the school-based health centers are going, what we're doing, what type of activities and grants and things that we have brought to the schools within the school system to continue to make the school-based health center and the school partnership, grow, and also the wellness and academics of the kids better. So again, why are school partnerships important? They play a role in health promotion, which I've kind of talked about, key role in academics, of course, and attendance. It also helps with sustainability of your school-based health center, and I'm going to talk about that in a few. It also allows more access to resources for students and families, resources that they may not be able to get outside of the school-based health center. And I'll talk about some things that we've done for food insecurities where we've allowed, more resources for families and students as well. So some schools partnerships that I'll be talking about, again, District Wellness Committee, Summer Pediatric Behavioral Health Program, a district wraparound program. So the Dougherty County School System has a wraparound program. And so in that wraparound program at this particular building, which is centralized, they actually have different types of services where parents can come along with their child, and if they need certain services. For example, we have an individual through the health insurance marketplace that has a spot inside of this area where parents can come in if their child is Medicaid has lapsed, then or they need to enroll in Medicaid, we can help them with those things. Or if they want to tap into the health insurance marketplace insurance, then we are there to assist them with those things, or they can make an appointment with us. They also have like a behavioral health person there, et cetera. So there's a lot of services within this wraparound program to be able to help the families and the parents and the students for any type of resources that they need within the community. Community garden, food insecurities, adult wellness month, flu vaccine campaigns, Shape America grant. A little bit about the Shape America grant. This is a grant that we had to apply for on behalf of the school. And with this grant, we was able to build a track around Turner Elementary, actually. So there was some funding. Some of the funding we was able to, again, build a track, and also the school system helped with the other half of the cost of the track. And so the purpose of the track was for the families to be able to come out and walk or run or jog together, and just promoting fitness for the students and their families at this particular school. And there's other things that we have done with this grant as well, which I'll talk about in a few. And then with the School-Based Health Alliance, we actually participated in a essentially STD AIDS awareness, they call it the DASH grant, a couple of years ago. And I'll talk a little bit about that as well. So Summer Behavioral Health Program. So in the Dougherty County School System, we actually started a summer pediatric behavioral health program. So one of the reasons for starting this is to help continue continuity of care for students that really needed the service throughout the summer. And so we were seeing kids, of course, during the summer, but our school-based health centers are closed. I mean, you're seeing kids throughout the year, but our school-based health centers are closed during the summer. So what we did is coordinated working with the superintendent and the district, and we created 2 sessions for a summer pediatric behavioral health program during the summer. And so the superintendent came back and said, I want to make sure that my summer school students have a chance to attend this as well. Because at first we was just going to do 1 session, and that's how the 2 sessions came about. So we had like 1 session during the morning time from like 9 to 11 or 12. And then in the afternoon, when the students got out for summer school, those students could come. The school system helped with transportation services. They also allowed the students to eat lunch. Even the ones that were not in summer school, they were able to eat lunch once they got out if they needed to. And we could utilize the school system social workers. And so this was very good for the students to make sure, you know, especially the ones that really needed continuum behavioral health services throughout the summer. And, you know, we got feedback from about 2 parents that talked about, you know, how this program really helped their kids, you know, not, you know, having any services, you know, if we wasn't there throughout the summer. So this is a program that actually has been expanded with the school system, and the school system actually got some extra grant funding, and we are now doing things throughout the year with the, you know, a group of kids that are in this summer program as well. So that has been great for the partnership with the school system, and again, a partnership with for the kids for the summer. The district wellness committee, again, as I talked about, our clinic director for the school-based health centers at the time helped to chair, co-chair the district wellness committee alongside the director of nutrition services. And so we brought a lot of stakeholders, a lot of people. Again, we helped kind of revamp and bring up their district wellness committee. And so we had partners, the athletic director, the YMCA representative. There's a local farmer that's here within this community from Flint River Fresh. So though a lot of key individuals that came to the table, the director for the school nurse program, to help bring about different policy changes regarding healthy eating and social and emotional health for the students within the school system. And so we was actually, there was 2 good things, and there's more than this, but 2 things I want to highlight that came out of us being a part of partnering with the school system on the district wellness committee. Some policy changes is for the sports, just working with the athletic director, we were able to so kids would, you know, normally you see them selling like candy and probably normally unhealthy things. And so we was able to have where they had one fundraiser that was, you know, not just selling unhealthy things. And so that's kind of was a good thing because we're trying to promote wellness. And so that was one thing that came out of a policy change. And then the other thing is recess for students in the school system. And so one of the things, and this link here, these slides will be shared. You can click on it, and it's actually the local news story where the Dougherty County School System recess policy went under review, and it was approved that now students have 20 minutes of recess throughout the week, each day, even if their, you know, behavior is not the best, that they have to have recess. And so that came out of us, this district wellness committee, and policy changes that we actually made. And again, it made the local news here, which was great. And so before, students wasn't getting recess, and now they have recess for 20 minutes a day within the Dougherty County school system. So we were very excited about being able to make that policy change for the kids, for social, you know, emotional health, you know, kids, and promoting wellness, that they have recess each day throughout the week. So please click on that link if you get the slides and review that. For the food insecurities program, so each child that comes in, when they come in for a well child exam, we do our food insecurities assessment on them. And out of the kids, for the food insecurities assessment, working with the parents, because we do the actual assessment with the parents through the phone or if the parent is in person. And so out of this collaboration with the school system came a local farmer that has a program called Flint River Fresh. And so again, by screening the students and we identify who has the most needs, we actually have now started delivering fresh produce to families on a weekly basis. So every Friday, we're going out and delivering fresh produce of, different type of vegetables, etc., to families that really need it. And so again, that's working with the school system. Also, we've developed community gardens with the help of the faculty and staff, the parents, the students, and employees of the school-based health center. And so we have parents, students to come out and work in these gardens. And this was actually through a No Kids Hungry grant that we applied for and was able to do these things through that particular grant and able to buy the things for the community gardens. And so this was, we've actually spread this from Turner Elementary to community gardens and also delivering the fresh produce to our other school-based health centers within our district as well. So this has been a great thing for the students, the families. Another thing we've done is out of the community gardens is selling the produce to the faculty and staff. And so again, that partnership helps also get the faculty and staff involved in the school-based health center, and they can, buy the produce. And then we take so it's kind of also teaching the students entrepreneurial skills on how to do things like that. And so also those funds go back into the school and the school-based health center to continue to buy, things to plant things within the garden. And then the School-Based Health Center Alliance Dash Grant Program. So this was a program to help promote, sexual health, STD awareness, and testing. And we actually participated in this. And with this program this was within a middle and high school, we actually developed a youth advisory council. And the youth advisory council kind of helped us to know what the students wanted, give us information about how, STD awareness and within the school system, within the community, etc. We also had parents involved. We talked to parent groups about, STD awareness and, promoting sexual health, etc. Out of this program, we actually held an STD testing event during STD Awareness Month, which is in April. And we also held a youth summit event to promote STD awareness. So again, partnering with the school system, even though this was an STD, the youth summit was an STD event, the principal of the school at the time wanted us to tie it into their PBS program, which is their positive intervention. It's like a behavioral health program promoting good behavior. And so we tied that in, the youth summit into that program. And we actually held the youth summit on a Saturday. And again, the school system provided transportation for students that wanted to come to the youth summit that did not have means to get there on a Saturday. And so in 2018 is when we had this. It was in the Terrell County school system. It was open to grades 8 through 12th. Again, it was on a Saturday from 8 to 12. We also had lunch and entertainment. And we had a pinning ceremony and a special recognition for the PBIS members. And these are, again, students that are within that program. And so, again, all this came about through partnering, meeting with the principal, again, on a monthly basis and coming up with ideas on what is needed within this particular school system and the schools that we were in here. And then again, this is just showing you the program. We had different breakout sessions. It was excellent. We actually had a speaker that came, and she was in college and actually spoke on her experience as an HIV person, and giving the students advice and things of that nature on promoting, good sexual health, etc. Also, we spoke on like healthy lifestyles, sexting, cyberbullying, leadership skills, and a lot of other, different topics. And so it was a great program that we had within the school system and, partnering with them. And this is the speaker who posted something on Facebook talking about how she had the pleasure of speaking to the teens and telling her story of living with HIV and educating them a little more about, STD awareness, etc. And these are just some pictures. Also, the great other thing is partnering with the students. They actually, there was a video that was created and it was called the Sex Chain video. And again, once you get the slides, you can actually click on this link and it'll take you to the YouTube video. It's actually kind of a short movie, so it's like about 10 minutes. So if you get a chance, watch it. But again, it was the movie that they actually created was around STD awareness and anybody watching it, promoting good sexual health, etc. And so again, these are pictures from the actual youth summit and the different sessions. So as you can see, we had breakout sessions and we just kind of took pictures of the different sessions. Within our organization, we also have a Round White Part C HIV program. And so we also had individual staff members from that particular clinic that also came to help with this event as well, to help promote the event. So these are some comments from the Youth Summit from the students. Again, we wanted feedback from them, and they just talked about their favorite part was the video, understanding what HIV and AIDS really was, hearing someone, testimony that actually had HIV, the real life situations. And so again, this youth advisory council that we developed within the school actually gave us ideas on the youth summit as well. Like they, because they know what the kids, their peers like. So they would tell us, no, I wouldn't do that. Or yes, I would do this to make the program, very good. So they were kind of our spokespeople to go out to find out what we needed to involve within the program. And so again, this also helps promote, again, at some point, sustainability of the clinic, because the kids become very familiar when you're doing all these partnerships and things with the students, the parents, having them involved. People learn more about the clinic for it to become, to come into the clinic, to be seen, etc. We also held a phishing testing day. How this started, we said we would do out of this program of HIV testing and STD Awareness Day in April. So we did 2 dates in April of 2018, April 24th, April 26th. We actually did HIV testing and we did chlamydia and gonorrhea testing. And the testing was performed by the school-based health center nurses, the laboratory manager, and one of our registered nurses within the federally qualified health center. We tested a total of 79 chlamydia gonorrhea. We had 8 positive. So again, these students didn't know they were positive. So we was able to get them into the school-based health center to have them treated. And some of the students had well child exams. So we was able to then talk to, get them on the schedule with the parents to get them in for well child exams in the future. And then we did 47 HIV oral quick tests. We had 1 that was positive, but the confirmatory test came out to be negative. But the good thing is this student was sexually active. So we was able to educate them on the importance of using good sexual health, etc. And so how we actually promoted this event is during Valentine's Day, in the cafeteria, we gave out roses to all the young ladies within the cafeteria. And we was promoting the STD awareness event that was held in that April. And when we started passing out the roses and talking about the events, the students started asking, how can I sign up? And so we actually started a sign up list, and we did cover the names so nobody know who signed up, but a sign up list for kids, and then on the day of the event, we actually, you know, and secretly called them down to be tested for the event. And so we had, again, as you can see, a number of kids that wanted to be tested, and glad they did, because again, we had 8 positive chlamydia. And then again, this was our flyer. We actually created this. Again, you see the testing days there, but we actually put data and information about STDs on the flyer as well, and passed this information out. This is actually the flyer that we passed out during the when we gave out the roses in the cafeteria. This is we've like kind of started doing this every year now. So this is, I think, a different year. That's why the dates are different, but shows you kind of what the flyer looks like. Something else partnering with the schools, with the adults, is we also promote Adult Health Month. And so in May, and right before the benefits run out for the teachers or faculty and staff within the school system, in December, we promote Adult Health Month. And basically what this is we put flyers in their boxes, we take them to their classrooms, and we say, hey, if you have not had your annual wellness screening completed through the state for the State Health Benefit Plan wellness program, because the teachers in the state of Georgia have the State Health Benefit program, so they have insurance through the state. We say, hey, make an appointment with us if you would like to. And what the teachers and faculty and staff would do is write their names, their contact information, their preferred time for appointment, and we would get with them personally to make that appointment. And then they would come into clinics and be seen. And so we was able to capture a lot of the adults this way. Again, they partnering with them, et cetera, to learn more about the clinic, and showing this information and talking to this information to the students and the teacher and the students and the parents as well about things that we're doing within the clinic. Another thing that we've done with the faculty and staff are wellness breakfast days. So we've had healthy breakfasts that we have made for the teachers and the faculty and staff. And then we would have the recipes as well. And they would come in the morning time before they go to their classrooms, and they would be able to eat this healthy breakfast, but they will also be able to take the recipe for what was made and have that recipe. And it was to help promote, wellness, and hopefully they go back and teach the kids of their students on what is healthy to eat, et cetera, for breakfast. We also held flu vaccine campaign. So in the schools where we have school-based health centers, even the schools where we don't have school-based health centers, they could bring the students there. But we held school-wide flu vaccine campaigns at the school sites. And so basically we would send out a flyer and a letter along with the consent form home with all the students, and the parents can sign that consent and send it back for this child to get a flu vaccine. And the first year that we did this, the school, which was Turner Elementary, we got information from the district that they had the least amount of flu cases out of all the schools within the school system by us doing this campaign. I think they had, again, at the time they had 500 students, and we did over 250 doses of the flu vaccine. This also helped to increase the opportunity for the number of students using the school-based health center. So there were students that would come in for the flu vaccine, and we also would find out that they have not had a well child exam in like 2-3 years. And so we would talk to the parent about getting them on the schedule for a well child exam as well. And so that was good. This was good promotion. Again, partnership with the school system to help keep kids in school. So they're not getting the flu and spreading the flu if you do get it, etc. Parent engagement and outreach, school-based health center outreach, wellness, well child exam campaigns. I'll talk about that in a minute. The YMCA fitness nights. So this was something that was very creative that we have done as well. And we also done it with yoga. Is we would have, I think the first time we did the fitness night, we had where the parents and the students can come. We had 75 participants. They came, and we had our instructor to come and do fitness. Again, that's kind of coming out the district wellness committee with that representative from the YMCA on this committee, and we held a fitness night, and we had about 75 participants, and it went great. Health fairs within the school-based health center, where the parents, the students, the faculty, and staff can come, where we have different types of screenings, and then we make sure to follow up on those screenings if any were abnormal, like finger sticks, doing blood pressures, height and weight, looking at BMI, etc. I remember our first health fair that we had at Turner Elementary before we actually opened the clinic. One of the parents came to the health fair, and one of the teachers was so excited because she had been trying to contact this parent. So the parent wouldn't call her back, but she actually came to our health fair, and that teacher was able to, talk to the parent about whatever they needed. So again, these type of events and partnerships also help bring about, things that help the teachers as well. So that's why the engagement is very important. Also, I talked about the wellness track that we built around with the grant around the school. We also have different types of art contests, consent form contests, and then I talked about the employee wellness breakfast. So this is our flyer for our health fair. This was actually the first one we ever held at Turner Elementary. Again, we partnered with various different type of vendors with, working with the school system. We gave away free school supplies. We had health vendors there. We had someone there to help set up, enroll people into Medicaid if they needed to be enrolled into Medicaid. We had different types of Walgreens there and other vendors, and that's also free food, etc. And so it was, again, a great event, a lot of great turnout. And then again, the parents were able to, talk with the faculty and staff at these type of events as well. All right, so also this is a well child exam, us promoting, again, wellness. And so these are just like promotion things that we send home to the parents, and they can fill this form out. Like if they, telling them that school-based health center is here, you have an opportunity to get your child wellness exam because we want to keep kids healthy and in school. And the parents can check yes or no, I would like to schedule an appointment, or they can check at the bottom and say, I would like you to call me to provide more information about this, etc. We have found issues with kids during their well child exams that they didn't know they had, or they had symptoms but never ever said anything. And give you one example, there was a child that had came in and the blood sugar was high, and we actually sent a medication in to the pharmacy, etc. But what the grandmother didn't tell us is the child didn't have transportation, or they didn't have transportation to get to the pharmacy. If so, we could have delivered it to the home. We had the child coming back in the next day on a nurse visit just to recheck the blood sugar. And when we checked it, it wouldn't even register on our machine. And so that child had to end up being admitted, to ICU at the hospital. But luckily the child is doing well, is seen in our school-based health center. But that child actually just came in for actually a physical to do cheerleading. And actually, so we actually was able to find that issue that the child either didn't know they had or had symptoms, but did not go be seen about until they actually came in for that physical. And then here again, just promoting wellness again with the kids, 5th grade, you're moving on to middle school. There are certain immunizations you got to have, making sure those get completed because we want to keep all kids well and in school. So again, just sending this home to the parents, again, parent engagement, trying to get them to make sure their kids are well and so they can stay in school. The art contest, again, we get the kids involved in the clinic as well to help decorate the school-based health center. And so what we also do is we have a certain topic throughout the year. So this particular topic was on how to be a good friend. And so what we did is we partnered with the art teachers, and the art teachers would do education during art, along with working with us on what it means to be a good friend, And then the kids would paint pictures around how to be a good friend. Again, promoting good social, emotional health, behavioral health, etc. Was our thing. And then we take we like partner with Leadership Albany or Leadership Doherty in our county. And then they pick winners for each class. And then we take those and frame them in the school-based health center. So that has, again, this engaging the students, working with the art teacher is also education, teaching the kids on different, how to be a good friend, about bullying and not doing that and all those things. For our dental clinic, we've also done, again, working with the art teachers on dental health. And so working with our dental assistants and dentists and working with the art teacher, promoting good dental health. And we would have kids do educate them, and then they would do different types of pictures on what's good dental health. And then again, we would have someone select the good ones, and then we would take those, and we actually posted those in our dental clinics within the school-based health centers. And so the kids, when they come in, they can see their poster, and then we kind of rotate them out, the different types of pictures. And a lot of them did, great pictures. School-based health center transportation and mobile unit services. So I like to say this is a very creative, outside of the box thing. Is we have 2 mobile units within our organization. And so in Doherty County, for example, we have, there's about 22 schools within the county. And so we have school-based health centers in only a couple of the schools. It's not all 22 schools, but all kids have access to the school-based health centers that have the schools that have a school-based health center. And so it's 2 ways that they have access. Partnering with the school system, we actually, the students, is coordinated by the nurses and our patient navigator for the school-based health center. We assign each school that doesn't have a school-based health center to a school that does. And we take we get a list of kids, so we send consent forms home to those schools as well. And if the parents want them to be seen, we coordinate them to be transported by the school bus during the day. So the school system has partnered with us and allowed us to have students transported by school bus from their school to one of the schools that have a school-based health center that we have assigned it to, so those kids can be seen. So let's for say Doherty High School, we would transport those kids to Turner Elementary. We would have a date set on the calendar, and they would come over, be seen, and then they would go back to their school to go to class. So that had been very helpful. So like our dental clinic, we have a dental clinic inside 2 schools in Doherty County, but all students have access to it because of the transportation through the school system. The school system likes that because it helps them to be able to recruit bus drivers, because bus drivers now can actually kind of work all day instead of just working part of the day, and they can make more money. So that allows the school system to be able to recruit school bus drivers better, because they can actually kind of work all day by transporting the kids throughout the day to the school-based health centers. The other thing that we do is our mobile units, we do take them, now that we have those, we do take them to the school. So the nurse practitioners that are, and the nurses, the staff that are in the school-based health centers will have their schedule. Instead of the students have been transported by bus, a lot of times we'll just go to the school, park the mobile unit, and the students will go in, get the students, and they will be seen on the mobile unit. So we do that for primary care services. We do that for optometry services in some of our counties, like Terrell County, where we don't have an optometry clinic. And then dental services is something that we're actually looking at for some of the counties where we don't have a dental clinic. So again, this what we did is added this in the MOU for the school system about transportation services. And then it's also on the consent form where the parents can opt in or opt out for their child receiving transportation services. Telehealth, vision, and dental. We utilize telehealth services for the primary care and behavioral health services. One of our dentists also was gonna started using, it wasn't like teledentistry, but she used it to just connect with the parents to kind of talk to them about the treatment plans if the child needed a treatment plan. So she would do the exam because we got permission to do the exam, and then she would connect with them to discuss with them the treatment plan. And we could do it over the phone, but she also felt, the telehealth doing it virtually was also better. So we did have a dentist to do that. Sometimes, at school-based health centers, if we didn't have a provider that day, we would use the telehealth services. And then we also have it for behavioral health as well, where we had received a grant from HRSA, a capital grant at one point for one of the middle schools. And one of the purposes of the grant was to raise awareness of mental health services. And so in the middle schools, we put telehealth equipment for behavioral health so that they can tap into the therapist that was located at one of the middle schools. And then I already talked about vision services that we have and also dental services that we have. So how do partnerships and engagement lead to school-based health center sustainability? Is looking at it helps with bringing students into the school, because we have the staff in the school. We also have to make sure it's sustainable so it can stay there, so that we can provide all these services and these different partnerships that I've talked about to keep things going. And so looking at your data, etc., sharing this data with the school system, but these things help bring about sustainability. All the things that I've talked about help to continue to bring kids in. So this is just our data from Turner Elementary, of the different encounters, etc., that we see. Our dental services are not everyday services. It's only 2 half days a week, just due to the manpower. I don't have enough staff. We could actually be there more. So we just try to see as many students as we can. And then this is just a sample. We also do like tracking of quality data. This is some old data, but this is from 2014, 2015. Looking at asthma quality data. Again, the numbers, we look at the number of patients with asthma, the number of patients that have asthma that actually get a flu vaccine. And we kind of look at also if they are in our school-based health centers, the number of patients that have had with ER visits in the past 30 days, and making sure that we follow up on those students. Again, this is just the percentage of patients on asthma, the medications. And then we also have, I talked about a lot of these supplementary programs. Again, the partnerships with the school system. Again, there's things at the school-based health center that we can, again, help them with, different grants that they may want to apply for. We can apply for on their behalf, and just partnering with them on all these different grants. So we've done a lot of things within our school-based health center by partnering with the school system, and promoting different types of social and emotional health, obesity prevention, employee wellness, for the students and faculty and staff. And always remember, is about the people and building those relationships and who are the key players. So again, you have to determine who are the key players to make all of these partnerships happen. I can tell one of the important ones is and I don't have that name up here, but the front desk people at the school. They are highly, highly important. We make sure I make those people, our school secretary, that's our best friend. So, but everyone is important as far as partnerships and engagement to make everything successful. And as you can see, I talked about those pictures. This is actually in 2013. You can see when we did these contests that we've been doing, we hang the pictures up on the wall. And then this is some pictures from the health fairs that we held at some of the schools. And this is with the assistant principal right here. So as you can see how involved he is, as the kids holding up the pictures that they actually did in their art class. So I thank you. I can take questions or any comments, and here's my contact information listed here.
Thank you, Clifton, for a wonderful presentation. We do have a few questions in our Q&A, and please feel free for everyone to ask any questions in the Q&A box. The first question is, how do you do the wellness exams and get reimbursement if your provider is not the primary care provider?
So
So
in the
how do you,
States, oh, sorry, go ahead.
oh no, go ahead. I'm just going to repeat it. So how do you do the wellness exams and get reimbursement if your provider is not the primary care provider?
So it's going to depend on, I don't know what state you're in, but it's going to depend on your state. So in the state of Georgia, that used to be the case where you had to get, permission and then how many visits you could do if they weren't a primary care provider. It's not the case anymore in the state of in Georgia with Medicaid. So if there's another provider on the card, we can see that patient. That's not if that's answering your question. The other thing that, besides that, again, we can't see another provider's patient, but we do partner with the providers as well too. So there's, pediatricians, if we do see a child, we do, there are certain ones we will call them and make a follow-up appointment for that child with their pediatrician and send over the notes with the parents' permission for the day, the progress notes, so they can have them for that visit for the next visit with their pediatrician. And that's just kind of working with the different pediatricians to set that up for the ones that want it, so they don't think we taking their patients. Thank you.
Thank you. I'm sorry. And the next question is, would you be able to share a sample of the MOU that includes the transportation piece with the school district?
Certainly. Yes, I will send it to Shamika.
Thank you. And the next question is, do you have contracts with the providers you are working with?
Yes, our providers, we do have contracts with all of our providers. Yes. And those contracts include the time that they work for us, their salaries, kind of what we'll provide for them, office space, what their duties are, and any other things that we need in their, for their job, vacation, all that type of benefits that they will get, et cetera.
Thank you. The next question is, could you provide guidance on effective strategies to engage with the community and get involved in meaningful ways? I'm particularly interested in initiatives that have been successful in the past and strategies that align with their health center goals.
So I would say if you do not have a school-based health center advisory council, to get one. So the advisory council that we have consists of community members. And so what we kind of looked at was within the community where the school-based health center is located, who are some key players. And so like at Turner Elementary in Albany, Georgia, which is Dougherty County, there's Procter & Gamble. And so we had a retired representative from Procter & Gamble on the advisory council. And out of that came where Procter & Gamble every year here in Albany have this shoe donation, big fundraiser during Martin Luther King holiday. And we actually were able to donate some of that stuff to the students within the school's shoes within the school system. And our providers, all of our other providers, we have about 100 providers within our organization because we do a lot of other services, but they actually donated money and shoes and stuff as well that we could get to the students. So my point is I would an advisory council, probably start there, look at key players. I'll put parents on the advisory council, also students on the advisory council. And they, can help you with those things.
Thank you, Clifton. And also, they would like to know that they are the question. Okay. And then the next question is, does your MOU have a cost to the district for having a school-based health center?
If I'm answering your question correctly, we our MOU, our school systems that we're in do not charge us to have a school-based health center there. So it's in-kind services. So they do not charge us for using electricity, the building, etc. Because of the benefits of a school-based health center to them, of all the things that I just talked about, especially attendance and all the partnerships. They don't charge us for that.
Thank you. And we have time for one more question. And the question is, what would we say to the primary care provider to partner with them, be an extended part of their group, perhaps?
So it's going to depend on where you are and those individuals in that community. So, and what I mean by that, so like in Dougherty County, what we did is we sent out letters to all the pediatricians to just go ahead and alert them that we're opening these school-based health centers so they know. And then if they had any questions, they could give us a call at this number. And out of that, we had, again, about 2. And those are the ones that we partnered with to say, we talked to them and came up with a compromise that if we saw one of their kids, we would, with the parents' permission, send them the last note and call and make a follow-up appointment. In one county, we actually had to meet with the pediatricians face to face. And again, after we did the face-to-face meeting, went over fine, and we developed the same criteria that I just talked about sending the last note, etc. So again, I think it depends on what county and knowing those individuals and how to go about doing that. And again, just, yes, explaining to them that you're an extended part of the group. You're not here to take their, patients, but you can develop this type of process. But you're here the main goal is to keep the kids in school where they're not missing a whole bunch of school.
Thank you. And I'm sorry, one last question. They're seeking advice on managing parent consent forms. How do you typically approach this task? And are there any best practices or tips you could share?
So read that one more time. I'm sorry.
Yes. They are seeking advice on managing parent consent forms. How do you typically approach this task? And are there any best practices or tips you could share?
So, and please type more if they're not fully answering your question. So we send consent forms home at the beginning of the year. We try, again, it's going to depend on your school system and you have to kind of feel for that. We tried the electronic version. That did not work for a majority of our school systems. So we used the paper, but what we also did is we shortened the consent forms from what they were because to make them shorter for the parents. So we would send them home. We have done contests to get the forms back because people like contests. So we've done different things like that. And the teachers like it too. So we've done that, but we also are at the open houses and we have the consent forms at open houses, and because they're shorter, we try to get them to fill them out there and talk about the school-based health center so we can go and collect them then. At the PTO meetings, we do the same thing. And so the other interesting thing that we do is that once we receive consent forms back, we go through the school system partners with us and they give us a copy of the roster of every child in the school system. And so our nurses would go through that roster. And if they don't have a consent form for a child, they would also, send another one home and try to see if we can get it or, reach out to the parents.
Thank you, Clifton. And thank you for a wonderful presentation. And thank you all for joining us today. At this time, we are now going to ask if you can complete an evaluation of today's webinar. Also, that the webinar recording and slides will be available on the School-Based Health Alliance website and also the Health Center Resource Clearinghouse in the upcoming days. If you have any questions, please feel free to contact us at info@sbhforall.org. Again, thank you, Clifton Bush, for a wonderful presentation. Thank you all for attending today's webinar on partnerships and pathways to support healthcare services in schools. Have a good day. Thank you.